I have John Smith, a 55-year-old former football player status post a left knee arthroscopic surgery post-op day 6. He presents today for a new onset of left calf pain for 6 days. He reports that his left knee pain started post-op day 1, but his calf pain actually started 3 days ago after he stumbled over a cane. There is no fall or visible injury. The calf pain is dull, achy, constant 3 out of 10 pain at rest, but increased to 5 out of 10 with walking. He tried Rice method and Celebrex with minimal relief. The pain also wakes him up at night, but there is no shortness of breath or paroxysmal nocturnal dyspnea. Activity tolerance is limited by his pain. He reports there is edema below his left knee, but the right knee has no pain, edema, or anything. It's overall normal for him. He denies any fever, chills, chest pain, palpitations, tingling, numbness, nausea, vomiting, diarrhea, and unintentional weight changes. There's no joint stiffness or pain anywhere on his body either. For his past medical history, he does have hypercholesteremia that was diagnosed 12 years ago, and it's currently controlled with levostatin, 40 milligrams twice a day. He's also taking Celebrex, 400 milligrams twice a day for his pain. He's also taking baby aspirin every day because his friends told him that it's good for his heart. In terms of past relevant histories, he has 2 knee arthroscopic surgery total, one in 1947 and one in 2022. All of his immunization is up to date, no drugs, allergy, no recent travel or sick contact. His father, for his past medical history, family history, his father passed from an MI at age 65. His mom has diabetes, and one of his brother has hypertension, and his sister has hypothyroidism. He has a good support system. He works as an assistant football coach, and he teaches kinesiology. He overall eats healthy and have good amount of exercise every day with sports and his daily activities. He does drink about 1 glass of wine 3 times a week, but no tobacco use or illicit drug use. He is sexually active with his wife. In terms of ROS, besides all that mentioned earlier, he denies any skin changes such as rash, jaundice, itching, or easy bruising, no headache, dizziness, syncope, or loss of balance, no urinary symptoms, no upper respiratory symptoms, no emotional changes, and the rest of the ROS is overall negative. In terms of objective, his blood pressure is 166/99, pulse 90, respiratory 20, temperature is 100.1, and his oxygen is 98% room air. His repeated blood pressure is 170/100. For his physical exam, he appears well developed and well nourished. Male in moderate distress. He appears to be in pain and is grimacing. He arrived touchdown weight bearing to his left leg. Skin is clean, dry, and intact. Normal skin turgor, normal cephalic. ENT is clear. Neck supple. No bruit. Cardio is all within normal limits. Regular rate rhythm. For the MSK exam, he has 5 out of 5 motor strength in all extremities, 2+ distal pulses, and symmetric. His left knee has 2+ effusion and 2 healing surgical incisions anteriorly. Active range of motion 5 to 100, no erythema, no sign of infection. His left calf midpoint is mildly swelling, 2 to 3+ focal tenderness at midpoint, and negative Holman's. For his labs, CBC, CMP all within normal limits. No D-dimer indicated at this time. Chest X-ray is normal. For differential, before we move on to differential, double X ultrasound shows that there is a DVT. Okay, now moving on to differential. The differential, he has could potentially have DVT because though his Holman sign is negative, but he is high risk for DVT because of the recent surgery, and he also have calf pain. For another differential, he could have post-op infection because his temperature is elevated, but it's unlikely because the wound doesn't look like it's infected and it's healing as expected. For calf pain as another differential, because he stumbled over his cane and Holman's is negative. It could also be radiculopathy because the pain does go below the knee, but unlikely because he doesn't feel tingly, numbness, weakness, or loss of sensation. For my primary diagnosis for him, it's acute DVT on the left calf, and this is supported with his history of recent surgery, and it's confirmed with the Doppler ultrasound. For his secondary diagnosis, he has hypercholesterolemia, elevated blood pressure, family history of diabetes and thyroid disease, and he definitely needs to be observed for a potential PE because of the DVT. In terms of plan of care for the primary diagnosis, we provided option to treat the DVT outpatient or to be transferred to the ED via EMS for further evaluation. Patient understand the risk and preferred outpatient management. So we started him on Eliquis, 20 milligrams twice a day for 7 days. On day 8, we will change it to 5 milligrams twice a day. This will likely be an indefinite anticoagulation, but we will reassess that at the next follow-up. We will also order a serial blood pressure checks and additional labs such as fasting lipid panel, CMP, TFTs, and we will have the patient return in 1 week for follow-up and reassessment. Patient was also educated on DVT and the importance of taking Eliquis and monitor his symptoms. He was instructed to go to the ED if he feels any shortness of breath, chest pain, worsening leg pain, and or the edema. For his secondary diagnosis of elevated blood pressure, it's likely white coat hypertension, so we instructed him to monitor his blood pressure, keeping a blood pressure journal. For his pain, he can switch to Tylenol 500 milligrams a tablet to relieve his pain as needed, but he was instructed to not take any more than 6 tablets a day. For summary, he is a 55-year-old male, status post a left knee arthroscopic surgery post-op day 6, presents here today for a new onset of left calf pain started 3 days ago after he stumbled over his cane. Doppler ultrasound shows DVT, and he is being managed outpatient with Eliquis 20 milligrams twice a day, and was given detailed ED precautions and scheduled follow-up appointment in 1 week.